The gastric bypass is done quite frequently. It is different in that, unlike the band, the gastric bypass has some changes in your anatomy. The gastric bypass, as you can see here, we make a small stomach and divide it away from the rest of your stomach, and then we reroute your intestines. What this does is it prevents them from eating much food, and they don't absorb everything they do eat. The advantages to the gastric bypass is it has an immediate and quite impressive effect on diabetes. Patients will come in on quite impressive doses of insulin and multiple pills for their diabetes, and they'll drop to no insulin, maybe 1 pill a day, or cut from 100 units of insulin twice a day down to 10 units of insulin. The diabetic control after the gastric bypass is impressive, and it's about 80 to 85% of people with diabetes will have either resolution or significant improvement. Reflux is fixed by the gastric bypass 98% of the time. And so if you have severe reflux, the gastric bypass is the treatment of choice. This is a much bigger surgery than the lap band because this is not reversible. This also has some malabsorption component to it. So we are very particular about watching your vitamins that you take and making sure you eat the proper foods to keep your nutrition going. This operation has been around since the 60s, so we have the most long-term results with it. We do know that people who have this maintain at least 50% of their excess body weight, which is how we measure it, for 20 years out. So this is a long-term solution.